This conference will now be recorded.
So today we'll discuss regarding the question on Chittagong University on nervous system in final pop examination, and I think this question answer session will be helpful for the students who going to be appeared in final prop examination in next November. And in medicine department, we will take every day 1 hour class by teachers, including me. Today, Dr. Ganesh will take 2 class on OSPI system, and Professor Dilip Kumar Roy also take 1 class on OSPI. And I will take 2 or 3 classes on question of Chittagong University and Viva related question and answers. And when the college will open, we will show the cases and we will teach our students case related study. And now we will only discuss regarding the theoretical aspects of final product examination. And this class schedule for next 1 month is set up for Group B students, but those who are interested from other groups can attend. And after opening the class, and college, we'll teach the case related teaching, and then we'll take exam on what final, especially for B batch, and also A and C batch, though cannot pass in the next previous examination. And our block class will going to be started from June, July, August. These 3 months we will take classes on block system. And I hope with the grace of Almighty God, our students will be in good health and they will be in continuous touch of books and touch of study and touch of teaching, and they will prepare themselves slowly but steadily, and special care taking for their health. So now I want to start the discussion. So our first question was, a 25 years old man presented with acute paraplegia with upper motor neuron lesion. 25 years old man presented with acute paraplegia with upper motor neuron sign. Write down 3 important causes. And the important causes of this paraplegia, upper motor neuron type paraplegia, are Pott's disease, transverse myelitis, and multiple sclerosis. And our next question was, write down the relevant investigations for this disease. And for POTS disease, blood ESR will be high, and X-ray of the dorsal spine will show a reduction of the joint space with marginal erosion of vertebral bodies of the affected vertebra and soft tissue swelling and paravertebral shadow due to cold abscess. MRI of the dorsal spine will also show reduction of the joint space, soft tissue swelling due to paravertebral abscess, which compresses the spinal cord. And also we can see the erosion of the bone. And epilepsy of the paravertebral from the paravertebral shadow or cold abscess will confirm the diagnosis. For transverse myelitis, we have to do CSF study where we can get albuminocytological dissociation. And for multiple sclerosis, MRI of the small cord and brain will show plaques, spelling mistake, plaques of demyelination. And CSF study will again show albuminocytological dissociation. And we can do also vitamin B12 level in blood to exclude vitamin B12 deficiency. Now treatment outline of these patients. For POTS disease, we have to treat this patient with anti-TB drugs category 1, 4-FDC treatment, rifampicin, INH and pyrogenamide ethambutol for 2 months, and next 4 months rifampicin and INH. And general measures, catheterization and physiotherapy. For transverse myelitis, specific treatment, injection methylprednisolone 1 gram IV daily for 5 days. And general measures, again catheterization and physiotherapy. For multiple sclerosis, specific treatment, injection methylprednisolone 1 gram IV daily for 3 to 5 days, then tablet prednisolone 1 milligram per kg per day for 6 weeks, and beta interferon in case of relapse case of multiple sclerosis. Catheterization, physiotherapy, and muscle relaxation, especially baclofen, can be used. Now the question number 2, a 22 years male patient presented with 3 episodes of generalized seizure in last 1 week. How will administer first aid? How will you administer first aid for seizure in this patient? First aid, shift the patient to a safe place away from fire, water, and machine. And maintain ABC, airway, clearance, breathing, and circulation. Injection diazepam to relieve seizure and prevent tongue biting and avoid tongue fall of tongue. Transport the patient to nearby hospital and never leave the patient alone till full recovery. The second part of this question is, what are the indications of brain imaging? If age of the patient is more than 16 years of age, 16 years, not 18 years, 16 years, repeated seizure, not responding to anti-epileptic drugs, And third EEG shows focal seizure, and clinically a patient have features of focal seizure. So these are the four indications of brain imaging, especially CT scan or MRI of the brain. Now question number 3. A 20 years old male patient admitted in this hospital with fever, headache, repeated vomiting for 4 days. On examination, neck rigidity present. What is your diagnosis? Our diagnosis is meningitis. And our next question was, what investigation to be done for diagnosis? First investigation is CSF study, and in viral meningitis we will get cleared CSF and lymphocyte count on few lymphocyte count 10 to 2000, and protein mild increase or normal, sugar level normal. And in case of pyogenic meningitis, the color will be turbid and cytology neutrophil count will be 1000 to 5000, and protein markedly increased, glucose decreased, and culture sensitivity can shows the growth of the bacteria. And in case of tuberculous meningitis, the color will be not turbid, it will be straw colored, and the cell count will be lymphocytes 50 to 2000. Protein increased, glucose decreased. Now, the principle of treatment of this meningitis. In case of viral meningitis, injection acyclovir 10 milligram 8 early for 14 days, and injection dexamethasone 5 days. And pyogenic meningitis, injection ceftriaxone 2 gram IV 12 hourly for 7 days, or injection benzyl penicillin 2.4 gram IV, এটা 4 hourly হবে, not 6 hourly, 4 hourly for 10 to 14 days. And injection dexamethasone 5 milligram IV 6 hourly for 5 days. For tubercular meningitis, anti-TB category 1 treatment with 4 FDC for 2 months and rifampicin INH for next 4 months. And in addition to the anti-TB drugs, we must give tablet prednisolone 1 milligram per kg body weight for 4 to 6 weeks. Now question number 4. A 70 years old male presented with fever, loss of consciousness, and examination of the nervous system revealed bilateral plantar extensor. Write down 4 differential diagnoses. Encephalitis, brain stem hemorrhage, stem spelling mistake, brain stem hemorrhage, ixol, especially brain abscess, and meningoencephalitis. Other signs of encephalitis: convulsion, aphasia, hemiplegia. In case of brain stem hemorrhage, pontine hemorrhage, pinpoint pupil, pyridoxia, hyperpyridoxia, periodic breathing, and bilateral extensor plantar response, and unconscious patient. And ixol, especially brain abscess, it can produce headache, high fever, convulsion, vomiting, bradycardia, and loss of consciousness. And in case of meningoencephalitis, neck rigidity will present along with extensor plantar response and fever. Investigation: CT scan of the brain and show high density area in pons and midbrain in case of brain stem hemorrhage, and MRI of the brain can show ixol in brain. CSF study after exclusion of the raised ICP in case of meningoencephalitis and encephalitis. The color of the CSF will be cleared, cytology few lymphocytes, protein normal, sugar normal, and complete blood count. There will be neutrophilic leukocytosis in case of brain abscess. And last question of today's discussion is your question number 5. A 28 years female admitted with the complaints of severe headache associated with vomiting, which exaggerated by coughing. On examination, pulse 50 beats per minute, BP 160 by 100, bilateral plantar extensor, papilledema present. What is your diagnosis? Your diagnosis is raised intracranial pressure. And possible causes of raised intracranial pressure are ixol, especially brain tumor, meningioma, pituitary adenoma, ependyoma, glioma, metastatic tumor, and brain abscess. Now, principles of treatment of this patient: medical treatment, injection dexamethasone 5 to 10 milligram IV 6 hourly, injection mannitol 400 ml IV over half an hour, and tablet phenytoin 200 milligram 2 tab daily in case of convulsion. And surgical treatment indication meningioma and pituitary adenoma. These two can be surgically resected, and radiotherapy in case of metastatic tumor and pituitary adenoma. So this is the line of treatment or principles of treatment of brain tumor or raised ICP. So this is the end of today's discussion. So last of all, I again pray to Almighty God for good health and healthy life of my students, and I wish they will continue their study in good health, and they will take preparation for next. So again, thank you. Thank you.
Thank you, sir.
Thank you.
Thank you, sir.
Thank you, sir.
Mustafiz, gus karo uska. সানি
হ্যাঁ কিরে
ওই সনি
এ ইয়াস
শুয়েব বন্ধু আনি হাওয়া
রনি হোস্টেলের ব্যাপারে তো কোনো
সর্বনাশ করলাম।
সিদ্ধান্ত হইলো না।
স্যারে হাওয়া দিতে কতদিন? এ মাহমুদ
হুম?
হুজুর অনেক চেষ্টা করতেছি কুমিল্লা আসার জন্য কিন্তু কুমিল্লা আসতে পারতেছি না সবকিছু বন্ধ